So good morning again. Good morning, everyone.
Good
Imagine
morning,
a
sir.
day,
Hi, sir. Good morning.
imagine a day without clear vision. Colors fading, details disappearing, and the world turning blurry. Eye health often goes unnoticed until a problem arises. So today, let's take a closer look at we can keep our and others' eyes healthy and vision strong. It's my pleasure to be here today and to share insight on the topic that literally shapes how we see clearly the world, like myopia control. Thank you to the organizing team. Thoroughly, this in session we will talk about myopia control, prevention, and factor influencing the myopia, and the principal management guideline and optical and pharmacological interventions. So, why should we concern toward myopia? As we already know, myopia is refractive error, but nowadays, due to our habits, due to our lifestyle, it's dramatically increases. Means prevalence of myopia is increasing exponentially. So consequences of myopia related to ocular disease that leads toward the diseases. And third is the economical burden of myopia. So first, the prevalence of myopia, as we already know, it's exponentially increasing. And in 2000, when its survey was done, worldwide 2.75 of the world population was myopic. But after the pandemic and due to the present scenario, the prevalence of myopia is increasing continuously. So why are we concerning about myopia? Because it's leading toward the diseases like the retinal detachment, macular degeneration, maculopathy, posterior staphyloma, PVD, open angle glaucoma, and cataract. So why? Here are some factors influencing the myopia, like the genetics. If parents are myopic, then the probability of the child is becoming myopic is more. Excessive near work and digital screen, which is the prominently and exponentially increasing nowadays. Everyone almost on a screen 6 hours or more than that. And next is due to the lifestyle change, reduce the outdoor exposure. In usually in case of the childrens, they are working. Their work means homeworks in indoor, and they are not going outdoor and environmental conditions. So what happened when myopia progress? Why we are concerning about the myopia progression? So first, we already know in case of the myopia, the rays focusing in front of the retina. But when we correcting by single vision, in that cases, the center image pointing on the retina, but the peripheral, because of the shape of the our eyeball, the peripheral portion is defocused, and it's focusing just behind retina, means hyperopic defocus. That stimulated further increasing the axial length. That is the main cause of progressive myopia. So what we will do, the what means what the guidelines provided by the myopia committee. So by that they are just given the impact myopia management guideline. What the meaning of impact is? Eye indicating the identified true axial myopia. Axial means due to the axial length progression, means due to the axial length. Next is the map the risk factor which influencing the myopia. Next is pick the progressive myopia, because if the myopia is not progressing, it's not so bother. Means we just correct it and leave like that. Next is advice appropriate myopia control strategy. Means we have to decide for particular person or for particular child to particular treatment modality and strategy which help them to improve and control the myopia. Next is consult, counsel, and monitor the regularly means progression. We have to means we have to progress, check the progress, and according to that we have to take the action. Next is the taper and cessation of myopia control strategy. When the child is or particular patient is the progression is stopped, then in that cases we have to taper. Taper means we have to change the prescription modality. Means we have to just reduce. If we are giving the pharmacological treatment, then we have to taper the doses and cessation of the medication as well as the particular spectacle. So its strategy for the myopia management is here. Early detection, we have to detect the early as possible as means we have to just give the message to community to come and just check their child regularly, at least till the 10 and 12 years of age. Next is lifestyle modification. Next, clinical intervention and patient education. Patient education is very important. By that, they can understand the importance of the myopia control. As we know, lifestyle and environmental changes like the outdoor activity helps very significantly in the myopia control. Reduce continuous near work and follow the 2020 rules. Means we have to see at 20 feet, means more than 20 feet after the 20 minutes of work for the 20 seconds. Means we have to just change our focus from near to distance. So it's help to relaxation of the eye as well as in myopia control also. And in ergonomical changes, we have to sit properly in proper position. And when we sit on proper position, it should be important. The working distance should be suitable or proper, like the more than 30 centimeters. And for that, the elbow rules also applied to avoid the closer reading distances. Use the larger font in case of the small childs and anti-glare screen if the child is using any type of the devices, if it's very important for them. Otherwise, avoid the near work as well as the screen time. Next is obviously we know the nutrition and eye health is also very important for everyone. So balanced diet rich with antioxidant vitamins like the vitamin A is very important for the eye health, and omega-3, hydration and adequate sleep. Sleep is also very important factor for the, because we know the myopia is not a single factor, means it's multifactorial. The risk of the myopia progression is multifactorial. So we have to see the all aspects. So adequate sleep is also very important, and role of general health and wellness and visual health is also very important. So what is the principle of myopia control basically? So we know by the single vision we focus on the center, but in case of the myopia management or control, we bother about the mid peripheral, peripheral or rays, that all focus on the retina. So by that we get almost clear image on whole retina. So we have intervention that helps us or slow down the myopia progression. First is the optical intervention, and second is the pharmacological. interventions. So optical interventions are spectacles, contact lenses, orthokeratology. These are the optical intervention. For the spectacle, the DEAMS, Hall, Clear, Myriad, these all are different type of the spectacle lenses which have the particular the zone, mid peripheral and peripheral zone that just reduces the defocus, hyperopic defocus, and focus on the retina. Contact lens, multifocal, dual focus, concentric design contact lenses, and EDOF contact lenses. Orthokeratology, obviously, it's also helping in controlling the myopia. And in last, the combination therapy in some cases we are also using. Means we are using the spectacle orthokeratology or we are using with orthokeratology the low dose atropines. So spectacles lenses, before that, we know for correction, the hypothesis is like that by decreasing the accommodative demands at near, it's induce the myopia defocus and result more rapid myopia progression and axial elongation. And in case of the bifocals, the hypothesis was decrease the accommodative demand like and that statistically significant but not clinically relevant and usually or sometimes it's difficult to the child or patient to use the bifocal or progressive. So now new innovation and innovative spectacle lenses are available in market that with new technology that control the myopia progression like DEAMS, Hall, Clear and Myriad. So first, DEAMS. So what is DEAMS? DEAMS is basically the defocus incorporated multiple segments. So here we can see in image also the multiple small central zone 9 zone diameter have the center clear vision and in mid peripheral zone have small multiple defocus segments up to the 33 diameter surrounding the center zone. So a plot of the positive power macro optical segment on the front surface, those segment will generate an additional focus plane on the retina that myopic defocus. So by that, the all rays will focus on the retina, and these myopic defocus can control the growth of eyeball, retarded the myopia progression up to the 59% as studies shows. Next is the halt. Halt is the highly aspheric lens-led targets. It's the stainless lenses given by the SLR company. And technology consists of a consultation of aspheric lenslet spread over the 11 rings, which we can see in the image also, and designed to create for the first time a volume of a single and slow down the elongation of the eye. The power on each ring has been determined to guarantees a volume of single always a front of the retina that signals which focus in front of the means retina and follow the shape according to the retina and achieve the consistent myopia slowdown. This technology slow down the myopia to the 67% in average if the child is using 12 hours per day. And next is the clear lenses that also known in market in myopia. And clear full form is that is cylindrical annular refractive elements CARE. So alternating defocus rings and correction zone in a ring-like pattern on the front surface, expanding toward the periphery of the lines. These microstructure deliver the stop signals, and it's up to the 86% for the children up to the 10 to 12, and 63% of children 7 to 9% controlling the myopia. Next is the MIRAT, myopic 2, micro infused radial defocus technology distributed over the lens through through the 12 layers of the equidistant radial rings belts. The design produces up to the plus 4 to the plus 3 means the 3 to 4 forward defocus effect and peripheral image that aligned with the curvature of the retina. Means in all cases, means all these design just they are focusing peripheral portion to the retina. By that, the retina is getting the clear vision, and that the main factor which reducing the progression of the myopia. So result, the light focus slightly in front of the retina as previous focusing behind the retina, due to that creating the hyperopic defocus, and by that myopic defocus effect slow down the axial length of the eyeball. So we are, except then the spectacle, we are also using the contact lenses, the soft contact lenses in myopia management. The center distance multifocal contact lenses are successfully used and control the myopia supported by the scientific evidences. Means they are also giving the peripheral defocus, and it in the form of the ring from the plus 1.5 to 2.5 diopter. Majority in cases the plus 2 is the good option for giving this type of the lenses, and we are advising these lenses to the children, and daily disposable modality is recommended usually because the children are more active and to reduce the infection and other things. The power available up to the minus 12. My side, one day multifocal like contact lenses up to minus 6 diopter. Next is EDOF lenses, extended depth of focus lenses. So these are also multifocal lens design, and they also have the center distance option and add power place immediately next to the center zone, and this also creating the blur at the peripheral retinal zone, and by that they enhance the depth of perception, and that can achieve with these lenses. And power range is up to 12, and addition is whatever giving for the defocus is plus 0.75 to up to plus 2.25 diopter. Next is the orthokeratology. These are also lenses, but these lenses are something like sleep and see the clear, like contact lenses. Means you can use these lenses at night, and in daytime you will see the clearly, means without the lenses. So these lenses are especially designed and fitted contact lenses to reshape the cornea to improve the vision. Means we just pressing the center portion of the cornea, by that we are getting the clear vision. So we can see the with these lenses also clearly, and without these lenses we see the clear after removing these lenses, because these lenses are reshaping the corneal central zone, and these lenses are FDA approved for the overnight wear also. And these indicate the correction of myopia, astigmatism of all age of means patients. Means it's not like that it's prescribed in children's only. We can prescribe these lenses in all age groups. This design is reverse geometry design, because already I'll inform they have the center reverse zone here in image also seen there. The base curve is pressing the center portion of the cornea. And in mid-peripheral zone, this is the reverse curve. So by that, we are achieving the defocus zone. The center cornea is just focusing on the retina, and by that, we are getting the clear vision. So it's flattening the center cornea. And mid-peripheral steepening create the peripheral myopic defocus. And for the stability, the last portion is alignment curve and alignment zone is helping. And slightly the S lift to just exchange the tear film. And last is the pharmacological intervention to correct the myopia. So nowadays, low dose atropine from 0.01 to 0.05% using for the controlling the myopia. It's safe, effective in slowing the myopia progression and monitoring requirement. Whenever we prescribe these type of the medication or pharmacological intervention, we have to take the follow-up of that patient. Side effects sometimes photophobia, blur for the near slightly, stinging and the lower side effect of the stinging effects also seen. So emerging technology, AI-based screening and monitoring for the myopia progression, smart spectacle contact lens, whichever already available in the market, we can use with the help of technology, and with the help of technology, we are creating and in our doing the research and development, and by that we are getting the new technology which helps to control the myopia progression. Digital behavior monitoring, like the apps, by that we can assess how much time the patient or children is spending on the devices. So next is the combination, means the holistic care, for the integrated holistic care. We are using the combination of the optical, pharmacological, as well as the lifestyle changes. And obviously, the role of yoga, mindfulness, and stress reduction is also helped. Parent and child education is very important for the compliances. By that, they will follow the proper advice, and by that we will get the best result. Here we take a study result. It's a review of the study. It's indicating that when we are using with, means correcting with the single vision lenses, it's in a purple color, you can see the progression of the myopia is increasing. But when we are using these lenses, different type of the lenses, then we are seeing the progression is less, means axial length increasing less in compared to single vision lenses. So these all modality we can use with combination as well as separately also. It's different from person to person, means children to children. So now take away messages, educate families with effective myopia management strategy to promote the healthy vision and enhance the quality of life for the children and adult alike. The key to managing myopia is early intervention and proactive strategy. Means whenever we detect early, we can give or advise the intervention, and by that we will get the best result. So there is some references. Thank you.
Okay, sir. Mm.
So now you can ask the question.
Thank you so much,
And
sir, for
what
that
your
insightful
suggestions?
and practical presentation. Now we will open the floor for a question answer session. We have received some really interesting questions from the audience. I will be reading them out one by one for you, sir. First
Okay.
question, what is the role of ortho K lenses in myopia control?
Actually, the ortho K lenses are previously used for only reshaping the cornea and correcting the cornea, means myopia. But nowadays, because of their nature and because of their central
हाँ, तो क्या बोलना है?
corneal curvature changes ability, we are using it as an myopia control because center portion is reshaping, but peripheral portion is creating the defocus zone. So similarly, we see in the spectacle lenses also. Here in orthokeratology, we are also just implementing the same thing.
And the
We
next
are
one.
just correcting the center portion with exactly the number, and in peripheral we are getting the
Any other question for
defocus zone,
ophthalmologist side?
which
Side. ये बोलना है?
reduces or abolishes the
So
peripheral
guys,
defocus, hyperopic
end
defocus.
the session.
So we are getting the whatever we want for the correction of the myopia as well as for controlling the myopia.
How to know that
Thank you so much, sir.
Next question, how to know that child has or is going to myopia progression only by looking at the increasing spectacle number, any other way, and what is the first line of treatment to the children to these children?
Actually, when children come, that time we check they have the previous record or not. If they have the previous records, we can assess on the basis of that the child have the progressive myopia. And next,
तीन
when
चार
child will come in our OPD or clinic, we can check the curvature of the that child,
ये lenses are
corneal curvature,
तो कौन है so
and if the instrument
so
available like the
yeah
to
with
check the axial length, it's better for that. But single in single visit we can not decide that it's due to the corneal curvature or it is due to the axial elongation. So we have to check once, check of axial length, curvature of cornea, the pass, and we will call after 3 months again. We can start the single means one modality like the spectacle. By that, the whatever going to change in the one again in 3 months, we can also assess as well as we can check again the axial length. If the axial length is increasing after 3 months also, it indicating the myopia is axial myopia or progressive myopia, which we can control by giving these all interventions or modalities.
Hello, sir.
Yes,
Good morning, sir.
sorry sir there are people.
it's better to
Sir, I
ask
have a question.
if
The orthokeratology only work for can slow down the progression of myopia, and it's just used for the refractive correction.
It's for both correcting the myopia as well as for the
Okay, it's so ये okay okay ठीक है सर, thank you. Sir, can you explain it how it's work, like how it's slow down the myopia progression? Basically, I know um, there's some optics of orthokeratology, but how it's slow down it? Like basically, the child have axial length myopia progression. So how it's helping?
as we already discussed in my presentation also, you know what we are doing basically. We are just clearly advising the lenses, means ophthalmological lenses, means spectacle lenses, which have the center clear zone, but the mid peripheral zone is blurred or compensated according to their defocusing, means hyperopic defocusing. So here also, if you see in orthokeratology, the center portion is clear, but in a particular specific type of the orthokeratology, which is prescribed in case of the myopia control, the peripheral, mid-peripheral zone, already you know the reverse zone, they also have the particular defocus curvature. By that, they are defocusing the mid peripheral and just focusing on the retina, or defocusing means blurring the image. So by that we are achieving the clear vision in the center, and the hyperopic defocus, whatever is stimulating to eyeball to increase their lens, is reduces or abolished by help of that defocus zone, which is available in the mid periphery of the orthokeratology.
Okay, sir. Thank you.
Next question. What's pardon? Multi? Okay. Okay. Actually, sometimes a single means single therapy is not working well in some cases, because we know we have the human body, and the every person have the different biological uh, changes in their particular body. So we cannot assess everything in means OPD. So we have to give one modality like spectacle lenses, and then we have to see in again in the next follow up it's working or not. If it's not giving proper or as expected result, then in case we will advise the another modality, or we can use the combination of these therapy, and by these therapy we will achieve the whatever we are going to achieve. Yes, obviously, if we are using only the single vision lenses, obviously the hyperopic defocus is present in periphery, that is stimulating the eyeball to for the elongation. So it's not better option for correcting the myopia. No, nothing is like that, but we have to take care of lenses and our eye. Whatever the optometrist or eye care practitioner is advising you, you have to follow all the things, and you will not get any problem at all, because these lenses you have to remove in daytime, and when you remove in daytime, the proper oxygenation goes to the means cornea, and by that the cornea will be very healthy, and you feel also the more comfortable. Actually, Still, the government is not such aware to know about these the myopia. They know very well the myopia is progressing, but the government sectors, they just focusing on the cataract. Still they are not going toward the refractive error as much as requirement. Means they are sometimes they are just in means CSC or PSC, they are providing the single vision lenses, and they are not bothering about the some strategy or myopia control plan. So as per my knowledge, I unaware of these all things, but it still they not supervise the myopia control procedure. Contraindications. As you know, the contact lenses always have some problems if you not follow the proper guidelines. Means if you not wash your contact lenses, and if you are not taking from the particular optometrist or eye care practitioner that lenses, then it's going to create the problem. If you are following the all rules, means you are cleaning with the multi-purpose solutions and taking care of your lenses as well as your eyes, then nothing will happen in your eye. It's a topic of discussion, but if you are talking about the treatment, obviously we are treating the myopia from long time, with the single vision lenses or contact lenses. But nowadays, with the help of technology and with the help of the knowledge and uh, evidence-based researches, we know that we can control, we can these lenses and the pharmacological intervention going to help us. So we are using, and that's the reason sometimes it's a dispute like the term dispute control or management or treatment. So we have not just bother about the terms, we have to focus on the what the purpose of our existence. Means if optometrist is available in that society, we have to spread the information about the myopia control. So by that, whatever the small child, if they have the age of 3 and getting 3 diopter myopia,